Over 95% of Africa's 1.2 billion people are still without insurance cover due to poverty and lack of awareness. SOSO Care is a micro-health insurtech on a mission to provide millions of people with access and the ability to finance quality healthcare using alternative insurance premiums. They encourage people to gather their recyclable waste, which can be turned into health insurance benefits through the SOSO Care agents, making health insurance available and affordable for more people while reducing waste, environmental pollution. Please welcome SOSO Care.
Hi everyone, it's good to be here. I'm super excited to be here. My name is Nonso Oporom, and I'm the founder and CEO of SOSO Care. Access to quality healthcare is a great problem in Nigeria and in most countries across Africa. As a salesperson trying to sell insurance, I struggled a lot trying to communicate the importance of insurance. Most times when I go to sell insurance to people, they tell me that it's not practically their basic need. People think about food, clothing, water, and other basic things. As a salesperson, one day I met a woman trying to convince her to buy medical insurance. But at that moment, insurance was not practically her need. Both her and her children were exchanging plastic. They were trying to gather some plastic, move it to a herb store in exchange for some herbs. That was intriguing for me because this is me trying to sell medical insurance to some people, and they were already looking for alternative ways to finance their healthcare need. Like that woman that day, millions of people in Nigeria don't have insurance. Nigeria is a country with 210 million people, and 95% of the entire population don't have medical insurance. And because millions of people don't have medical insurance, they rely on out-of-pocket need to finance their medical needs. Sometimes this pushes people into poverty because of catastrophic healthcare financing. Think an example is the case of malaria that affects millions of people. Nigeria accounts for 50% of all malaria deaths in Africa and 25% across the world. This problem is not just around malaria, it's also with women trying to have children. It's not just about healthcare. One thing is millions of people cannot finance healthcare because government cannot pay for it. Another problem is there is massive level of waste pollution. Because of low incentive to recycle, there's this stigma around recycling. Millions of people don't want to recycle for low-level incentives because they feel there is this stigma around recycling. So most times when people, drink water or whatever it is, they throw it on the roadside. And sometimes this thing, block waterways, turn into breeding ground for mosquitoes. Mosquitoes are strong vector for malaria that end up affecting millions of people at the same time. This is a typical city in Nigeria, Lagos, a typical case when it rains. So everywhere there's drainage systems blocked with plastics and all of those things. So sometimes this plastic and pollution turn to a great public health problem, which in some way also affect the public life. As a company, one of the things we thought of was, during the pilot I did, I met a couple of women. I told them, what if I ask you to give me plastics, in return I can give you medical insurance? And they said, okay, no problem. And in 6 weeks, I had more plastics in my house than I could ever manage. So it kind of informed us that people are looking for alternative ways to finance their health need, even if they don't have money. And as a company, we understood that these both problems are huge and catastrophic. One is, how can people be able to finance insurance because they don't have money? It's not their primary need, it's their secondary need. And again, how do you build trust for a product that people have not used before, over 180 million people? No matter how much you try to convince them, they believe it never works. We created SOSO Care as affordable medical insurance that aims to allow people to exchange plastics in return for medical insurance. So that way you give us a few plastic bottles or whatever you have in your house that could be recycled. We have aggregatory community of people who pick it for every 100 meters where people live. That way it's easy to drop off recyclables across your nearest, maybe 4 or 5 blocks away from your house to your nearest agent, and you could get a medical cover. All you need to get a medical cover is just a telephone number. With a telephone number, we call National Data API to make sure that we have your entire data and process a simple medical insurance for you. We looked at different insurance policies, and we figured it's best to design a policy that works for everyone. Now, how does it work? We partner with some big insurance companies like AXA to design a simple and affordable outpatient care that could give people access to malaria, give people access to treatment of flu, catarrh, and diarrhea, so that way they can have access to the basic level of insurance. Our primary goal is to bring in millions of people to have access to healthcare for the first time, use insurance, and believe that insurance works. Now, you could simply give our agents a couple of plastic. You could go online, actually, buy the policy by downloading the app or whatever, then buy the policy depending on what you want for your small business or whatever. But for millions of people who don't have money, who live below income level, they could gather their recyclables. It could be plastic, used shoes, a broken bucket, whatever you've got in your home, since 85% of what you use in your home could be recycled. In 3 or 4 days, you can generate your premium to pay for insurance. You give it to the nearest agent. Our team go about, aggregate the entire waste, move it to our recycling center where they are processed. And when they are processed, they are sold to big recycling companies. And the proceeds are converted to health fund. SOSO Care return a portion of that, and a significant portion is used to convert your health insurance premium. The good thing is that for us as a business, we'll enjoy when people pay us with trash, because with microinsurance, the margins are small, and you need to sell large numbers to be able to turn profit. But with recyclables, we make 3 times our revenue with that, because we collect these recyclables, we sell them, we return a significant portion of that in profit, give away, use the remaining part to pay people's insurance premium. Then we also come to Europe here to sell the plastic credit to companies which are willing to offset their plastic credit. It creates 3 revenue streams for us, and that way we can make more money. We've been able to reach a significant amount of people. We've been able to serve for 5,000 people. Recently, we moved to Ghana, where we saw that API, because our primary goal is to bring millions of people to have access to quality healthcare. We want to go to communities, we want to be in Africa, we want to go to other countries in Asia, where there is urgent need for healthcare access and environmental intervention. So these materials, we collect them, we package them together, we sell them to big recycling companies who buy them for fiber or whatever they want to do with it. That way, they can convert it to resources that help to improve the environment. So SOSO Care is a mission-driven insurance. We try to solve 2 things. Practically, we try to bring in millions of people who have never used insurance in their entire life. We try to do this by building trust, establishing trust that insurance actually works for millions of people who believe that insurance is expensive luxury and can never work because of the claim process. We try to do this to also build behavior change around recycling and to encourage ESG across organizations. So we've been doing this for a couple of years, and we believe that our simple model could help millions of people have access to quality healthcare. Our solution is unique because practically we are the only insurance company that aims to use technology to create a trade by better system that can bring millions of people to have access to healthcare, whether they have money or they don't have money. So join us in this mission to ensure that millions of people can have access to healthcare, irrespective of their financial status. My name is Nonso Aporum. Thank you very much.